The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. I'm Physician Assistant Frank Smith. It's a patient request episode, and on this episode, we're going to discuss what it means for you when you establish care with a clinician. On my schedule, I usually have 2 established care appointments on my schedule. These are people who are coming into the clinic to establish care with me as their clinician. And it can range from age on folks that have graduated from pediatrics to more mature patients. And I usually have a couple of different speeches that I do during that appointment. I had a mom who had brought in her child in the last couple of weeks who had graduated from pediatrics. And at the end of my speech with him, the mom had said, "I feel like everybody needs to hear this." So I decided this is going to be a patient request episode. I'm going to cover the speech that I give all new patients first, and then I'll swing back around and pick up the one that I usually give to folks who have recently graduated from pediatrics or in their early 20s. So at the end of an established care appointment with a patient, and this is where I have gone through their past medical history, past surgical history, medications, social, all of that, I always end that appointment with, "You are now my patient. I am your primary care clinician." If you leave here today and as you're walking out the door, you're thinking, he seems like a nice enough guy, but I don't really feel that comfortable. I'd really rather have somebody else. At our clinic, you are allowed to change providers once a year with no reason given. If you've decided to do that, just stop by the front desk, tell them that you want to reschedule an established care appointment, and they'll get you set up with someone else. If you happen to come in a couple of months and I happen to be doing urgent care that day, and I see that there's somebody else's name on your chart instead of me, I'm not going to throw rocks at you. I'm not going to be mean to you. I probably won't even bring it up. Number one, you need to have a certain amount of rapport and comfort with the person taking care of you. And sometimes personalities just don't mesh, and that's okay. Now, at the clinic where your clinician practices, they may have different rules on switching providers. But I do say that everything that I had just mentioned is true. You do need to have a certain amount of comfort with the person taking care of you. I don't necessarily think it's a good idea for them to be friends with yours outside of the clinic, and I'll do an episode on that coming up. But you do want to have somebody that you feel like that you can talk to, that you won't edit yourself with, that there is a certain rapport. And if that's just not there, you probably do need to consider getting a different clinician. Now then, the speech that I give my late teens and 20-somethings when they come in. And frequently when they come in with a parent. So as I'm doing this speech, I want you to imagine that there's another person sitting in the room, okay? So the speech I usually give my teens and early 20s goes something like this. "You are now my patient. That is not my patient. You are my patient." And that means several things. Number one, what you tell me here dies here, period. Now that's actually the law, but even if it wasn't the law, that's how I practice. If you tell me something, it dies here. Your parent can come in here 5 minutes after you've left and say, "Hey Frank, I need you to tell me," "No ma'am." "But Frank, no ma'am." The only thing that you can tell me here that wouldn't leave here is that you are a risk to yourself or you are a risk to other people. Other than that, what you tell me here dies here. And that's really important. And here's why. You probably have this image of, oh, well, the only time I go to a doctor is that if there's something wrong with me. Wrong. What happens to you outside of here is part of your health, and that means it falls under my wheelhouse. So when life tries to jump up and bite you on the butt outside of here, and you don't know where to turn, when you run into one of those situations where you're thinking, Oh hell, I don't know what to do, man. I can't talk to my mom about this, and my friends are as dumb as I am. I don't know what to do. I don't know where to go. Yes, you do. Yes, you do. You come here. I will never shake my finger at you. I will never judge you, and I will do my darndest to never go dad on you. I will always have your best interests at heart, and I will do my dead level best to give you some direction that will be beneficial. When life out there gets in your way and you don't have anywhere else to turn, yes, you do. You come here, and don't you ever forget that. I know it sounds pretty dramatic, doesn't it? But that is the speech. And I have had a couple of patients point out to me, that isn't just limited to, somebody in their teens or 20s. And it's true. Every patient needs to understand we aren't just here for you have a runny nose, or you have high blood pressure, or you have diabetes. What happens to your life outside of here has an impact on your health. That makes it part of our wheelhouse. We will always have your best interests at heart. And when you feel like you don't have somewhere else to turn, anybody to talk to, never forget your clinician is there. Every clinician feels this way. Some do not articulate it as well as others, but I promise you, the person taking care of you wants to take care of you, whatever that looks like. We will give the best advice that we can. We will treat you medically, but we are also a good place to bounce life off of. We're here. And that's this week's show. That's what it means to be somebody's patient. I hope you've enjoyed the show. I hope you've learned something. If either one is true, please click the like and subscribe button down below. If you think there's somebody that needs to hear this, please click the share button. I'll be back next week. Until then, get better and make me look good. See you soon.